Welcome to the deep dive. Today we're going to be looking at child psychopathology.
Okay.
We've got a classic textbook here, Essentials of Child Psychopathology, and we're going to try to pull out some key takeaways about the core concepts, important milestones in the field, and some really interesting case examples.
Yeah, and I think what's so great about this textbook is that it really walks us through like the evolution of the field.
Right.
It's amazing to see how much our understanding of children's mental health has changed over time.
Right. It's like we've gone from just focusing on intelligence testing to, really recognizing the complexity of a child's environment, their relationships, their internal world.
Absolutely. And the book kind of highlights this shift by taking us back to the late 1800s and early 1900s.
Whoa.
So like imagine the very first psychology clinic specifically for children opened in 1896.
Wow.
It's focused on learning disabilities, but it really shows how long we've been grappling with these issues.
Yeah, that's fascinating how the focus has shifted, though. Like, back then it was all about institutions and intelligence testing, almost like we were trying to categorize kids rather than really understand them.
Yeah, and it wasn't until 1909 that the first Child Guidance Center was established. And get this, it was primarily for juvenile offenders.
Oh, wow.
So it's a stark reminder of how intertwined our understanding of mental health and the legal system has been.
It seems like for a long time we were more focused on controlling behavior than actually addressing, like, the underlying emotional and psychological needs of children.
You hit the nail on the head.
Yeah.
But what's exciting is that, moving forward to 1952, the first DSM was published.
Okay.
And even though it only included 2 childhood disorders,
Now.
it marked a significant step towards recognizing mental illness in children.
Right. It's a reminder that even our diagnostic tools are constantly evolving as our understanding grows.
Precisely. And then a major leap forward happened in 1984 when Sroufe and Rutter established the field of developmental psychopathology. They argued that you can't truly grasp abnormal behavior in children without first understanding what's considered normal for their developmental stage.
That makes so much sense. It's like trying to interpret a piece of art without knowing anything about the art, their influences, or the historical context.
Exactly. So this textbook really guides us through different theoretical lenses to kind of make sense of all these complex influences.
Like the biological lens, which dives into genetics and brain function, or the behavioral lens, which zeroes in on how kids learn through rewards and punishments.
You're right. But it doesn't stop there.
Okay.
The book also delves into cognitive processes, exploring how a child's thinking patterns and beliefs can impact their behavior and emotions.
So we're already seeing how multiple factors contribute to a child's mental health. It's not just one thing, right?
Right. And the book dives deeper into family systems theory, which emphasizes the role of family dynamics
Okay.
and how interactions within a family can shape a child's development.
And it reminds us that we can't ignore the sociocultural context. Cultural values and societal norms play a huge role in shaping behavior, and what might be considered abnormal in one culture might be perfectly acceptable in another.
Absolutely. And the book introduces this concept called triadic reciprocity,
Okay.
which I think is key to understanding child psychopathology.
Okay, what's triadic reciprocity? I'm intrigued.
So it's the idea that a child, their behavior and their environment are constantly influencing each other. So imagine a child with a naturally shy temperament.
Okay.
They might be less likely to initiate social interactions, leading to fewer opportunities to develop social skills,
Right.
which can in turn reinforce their shyness. So you see how it's the continuous loop.
Wow, that's a powerful concept. So understanding this dynamic can actually help us predict a child's behavioral trajectory and maybe even tailor interventions accordingly.
Precisely. And that brings us to another crucial concept the book explores.
Okay.
Risk and protective factors.
Risk and protective factors, so it's like a balancing act.
Exactly. Risk factors are anything that might increase the likelihood of a child developing a mental health problem.
Okay.
Think about things like a difficult temperament, exposure to trauma, or even poverty. Protective factors, on the other hand, can buffer those risks and promote resilience.
So a secure attachment to a caregiver, a supportive community, or even a child's own inherent strengths can act as protective shield.
Exactly. And what's interesting is that these factors operate at multiple levels: individual, family, community, and culture. It's like layers of influence all interacting with each other.
So a child's mental health is shaped by this intricate web of influences, both internal and external.
Right.
It makes you realize that we can't just focus on the child in isolation. We need to consider their entire ecosystem.
Exactly. Now, once we understand these influences,
Right.
how do we go about identifying and classifying mental health problems in children.
Yeah.
The book delves into two main systems.
The categorical system represented by the DSM and the dimensional system, right?
You got it. So the DSM being categorical is like a checklist.
Okay.
If a child meets enough criteria for a particular disorder, they get the diagnosis.
Right.
The dimensional system, on the other hand, views behavior on a spectrum.
So it's less about black and white diagnoses and more about understanding the degree to which a child might be struggling with certain traits or behaviors.
Exactly. And while both systems have their strengths and weaknesses, the book acknowledges that the DSM is still the most widely used in the U.S.,
Right.
primarily for its clarity and usefulness for insurance purposes.
Yeah. But regardless of which system we're using, the book highlights a fascinating shift in how we assess children. Like we've moved away from solely relying on standardized tests
Right.
and towards what are called functional assessments.
That's a game changer.
Yeah.
Instead of just labeling a behavior as bad or disruptive, functional assessments help us understand why a child might be acting that way. What purpose does the behavior serve? What need is it trying to fulfill?
So it's about getting to the root of the problem, understanding the context and function of the behavior rather than just trying to eliminate it.
Exactly. And the book provides a great example of a boy named Josh.
Okay.
He's constantly getting sent to the principal's office for disrupting class. A traditional assessment might label him as defiant,
Yeah.
but a functional assessment revealed that he actually hates math.
Okay.
And the disruptions happen most often during math class.
Oh.
So sending him out of class, even though it's supposed to be a punishment,
Right.
is actually reinforcing the behavior because it gets him out of doing the work he dreads.
That's so interesting.
Precisely. And that's why functional assessments are so crucial.
Yeah.
Once we understand the why behind a behavior, we can start to develop a plan that addresses the underlying need rather than just trying to extinguish the behavior.
So functional assessments lead to the creation of a behavior intervention plan or a BIP?
It's exactly. The BIP is a personalized roadmap for change, outlining specific strategies and interventions that can be used in different settings to help the child learn more adaptive ways of getting their needs met.
That makes so much sense. It's about finding solutions that work for the child, their family, and their teachers.
Right.
Now, I'm curious about treatment approaches. What does the book highlight in terms of effective interventions for children?
Well, the book discusses the rise of evidence-based treatments.
Okay.
These are therapies that have been rigorously studied and shown to be effective.
Makes sense. We want to make sure we're using methods that actually work. Are there any limitations to this evidence-based approach?
There are. One limitation the book points out is that we still need more research on treatments for internalizing disorders like anxiety and depression.
Oh, because those internal struggles can be less visible than externalizing behaviors like aggression.
Right.
So it makes it harder to study and develop effective interventions.
Exactly. Another key takeaway is that no matter what treatment approach we're using, it's crucial to consider the child's developmental level.
Right. A therapy that works for a teenager might not be appropriate or effective for a preschooler.
Right.
They're at completely different stages of cognitive and emotional development.
Precisely. A one-size-fits-all approach simply doesn't work in child psychopathology.
Right.
Now let's dive into some specific disorders, shall we?
Yes.
There's so much to unpack.
Okay.
But I think starting with ADHD is a great place to begin.
Okay, yeah, let's talk about ADHD. It's such a commonly discussed topic these days, and I'm really interested in how the book describes its impact on a child's life.
One of the things the book really emphasizes is how easily the inattentive subtype of ADHD can be misinterpreted.
Okay.
These kids might struggle academically even if they're bright, simply because they have difficulty focusing.
So it's not about a lack of intelligence, it's more about a different way of processing information.
Exactly. The book even uses the phrase sluggish information processing style to describe them.
Okay.
And because it's an internal struggle, these challenges can be dismissed as a lack of motivation or even laziness.
That's going to be incredibly frustrating for these kids and for their parents and teachers, too.
It is, and that's why understanding ADHD is so crucial.
Right.
It allows us to respond with empathy and support rather than judgment.
And this knowledge is valuable not just in school settings, but in all sorts of interactions with children.
Absolutely. Whether you're a parent, a teacher, or even just someone who interacts with children regularly,
Right.
understanding ADHD can help you approach those interactions with more sensitivity and effectiveness.
Okay, shifting gears a bit. Let's talk about those internalizing problems we touched upon earlier.
Okay.
Those anxieties and fears that can be bubbling beneath the surface. What are some of the key insights from the book about how these problems manifest in children?
Well, internalizing problems can be harder to spot than those more obvious externalizing behaviors, like aggression.
Right.
It's like trying to solve a mystery with only half the clues.
So we need to be extra attentive and look for those subtle signs that a child might be struggling.
Precisely. And the book reminds us that the nature and number of fears typically change as a child grows older.
Right. What might be a typical fear for a toddler could be cause for concern in a teenager.
Exactly. For example, many young children are afraid of the dark,
Right.
but as they get older, this fear usually fades away.
Yeah.
But if a teenager is still terrified of the dark to the point where it's impacting their life,
Right.
that might suggest an underlying anxiety issue.
So it's all about considering those fears within a developmental context.
Right.
Now, the book also talks about specific phobia. Can you explain what makes a phobia different from just a regular fear?
So a phobia is an intense and irrational fear of a specific object or situation.
Oh, okay.
The key here is that the fear is completely out of proportion to the actual danger posed by the object or situation.
So it's not just a dislike or a preference, it's a fear that's controlling the person's life.
Exactly. The book gives an example of a young girl named Winnie, who's terrified of dogs. Even though she knows that most dogs are friendly, she avoids them at all costs. She won't go to parks, visit friends with dogs, or even watch movies with dogs in them.
That sounds incredibly limiting. It's amazing how powerful these irrational fears can be.
They really can, and the book emphasizes that recognizing a phobia is the first step towards addressing it.
Right.
Many people with phobias feel embarrassed or ashamed, so they try to hide their fears.
So by recognizing the phobia and talking about it openly,
Right.
we can start to create a path towards healing.
Exactly. Once the phobia is out in the open, therapists can use various techniques like cognitive behavioral therapy and exposure therapy
Okay.
to help the person gradually overcome their fear.
So it's about understanding that the fear is irrational and then slowly, safely exposing the person to the thing they're afraid of in a controlled environment.
Exactly. It's a process that requires patient support and a trusting relationship between the therapist and the individual.
We've covered anxiety and phobias, so let's move on to another big topic, mood disorders in children. How does the book describe how depression shows up in young people?
This is where it gets really interesting. One of the biggest challenges in diagnosing depression in children is that they often don't express sadness in the same way that adults do.
So if they're not overtly sad, what are the signs we should be looking for?
Irritability.
Yeah.
The book highlights that irritability is often a primary symptom of depression in children. They might be easily frustrated, quick to anger, or prone to frequent temper tantrums.
So a child who's constantly grumpy and explosive might actually be struggling with depression. That's a game changer in terms of how we perceive these behaviors.
It's easy to misinterpret these behaviors as simply being difficult or oppositional,
Right.
but it's crucial to look beyond the surface behavior and consider what might be happening emotionally for the child.
And the book emphasizes that depression in children is not just a phase, it's a serious issue that can have long-term consequences if it's not addressed.
Absolutely. Early identification and intervention are crucial when it comes to childhood depression.
Now, what about those less visible symptoms we associate with depression in adults? Like low energy, changes in appetite, or difficulty sleeping? Do those show up in children too?
They can, but they might be less pronounced or harder to identify, especially in younger children who might not have the language to express their internal experiences.
So we need to be attuned to subtle changes in a child's behavior and mood.
Right.
And what about suicidal thoughts or behaviors? Is that something we need to be concerned about in children with depression?
Absolutely. The book addresses this difficult topic head-on, reminding us that even young children can have suicidal thoughts.
Wow.
We need to take all signs of suicidal ideation seriously.
It's a sobering reminder that childhood depression is not something to be taken lightly.
Right.
Early intervention can truly make a world of difference.
I completely agree. And speaking of challenging diagnoses, let's move on to somatoform disorders. These can be incredibly perplexing because they involve physical complaints that don't have a clear medical explanation.
So the child is experiencing genuine pain or discomfort, but doctors can't find a physical cause.
That's right. And it's not about the child faking it or trying to get attention.
Right.
Their distress is real, even if it's not rooted in a physical illness.
So if it's not a physical problem, what's going on?
The book explains that in somatoform disorders, emotional distress manifests as physical symptoms. It's like the body is speaking a language that the mind hasn't yet learned to articulate.
Wow, so the child might be experiencing emotional pain, but expressing it through their body.
Exactly. And the book makes helpful distinctions between different types of somatoform disorders, such as fictitious disorders and somatization disorder. In fictitious disorders, the person is consciously producing or exaggerating symptoms,
Right.
often to get attention and care. But in somatization disorder, the symptoms are not intentional. They genuinely believe they are ill and experience real suffering even without a physical cause for their symptoms.
That must be incredibly confusing and frustrating for everyone involved, the child, the family, and the medical professionals trying to help.
It is, the book shares a compelling example of a girl named Sarah,
Okay.
who is struggling with somatization disorder. She's experiencing a whole range of physical symptoms, headaches, fatigue, stomach aches. But doctors can't find anything wrong physically.
So she's in real pain, but the root of the problem lies in her emotional world.
Precisely.
Mm.
And it highlights the need for a holistic approach that addresses both the physical symptoms and the underlying emotional distress.
It's a reminder that we can't treat the symptoms in isolation. We need to treat the whole child. Now, shifting gears again, let's talk about those behaviors that tend to grab our attention more immediately. Externalizing problems. How does the book differentiate these from the internalizing problems we've been discussing?
The key difference is that externalizing problems are outward-focused. They involve disruptive, aggressive, or rule-breaking behaviors, the kind of things that are more likely to get a child in trouble at school, or even with the law.
So we're talking about kids who are often labeled as difficult or troubled.
Exactly. The book focuses on two specific disorders that fall under this umbrella:
Okay.
oppositional defiant disorder, or ODD, and conduct disorder, or CD.
Can you break down the differences between ODD and CD for us?
Of course, ODD is characterized by a pattern of defiant, argumentative, and hostile behavior. Think about those kids who are constantly questioning rules, arguing with adults, refusing to do what they're told, or deliberately annoying others.
So they're pushing boundaries and testing limits.
Exactly. But their behaviors are generally less severe than those we see in conduct disorder.
All right, so what does conduct disorder look like?
Conduct disorder is a more serious pattern of behavior that involves violating the rights of others and disregarding social norms.
Okay.
These kids might engage in aggression, bullying, cruelty to animals, stealing, vandalism, or other serious rule violations.
So their behavior is more likely to cause harm to themselves or others.
That's right, and the book emphasizes that the behaviors associated with conduct disorder often escalate over time. They might start with minor rule breaking and progress to more serious offenses.
That's worrisome. Are there any early warning signs that parents or teachers should be looking out for?
The book describes a developmental pathway for conduct disorder that often begins with ODD in early childhood.
Okay.
If those early signs of defiance and aggression aren't addressed, the behavior can escalate as the child gets older.
So early intervention is critical here, too. It seems like a recurring theme throughout our discussion.
It absolutely is. The sooner we can intervene and address these challenging behaviors, the better the chances of preventing a more serious disorder from developing. Now, the book also dives into the possible causes of these externalizing problems.
I'm all ears. What are some of the factors that might contribute to ODD and CD?
The book explores several factors, including biological influences like temperament and genetics. It also highlights the role of family dynamics, particularly parenting styles. For example, harsh or inconsistent discipline can actually make aggressive behavior worse.
That's interesting. You'd think that being stricter would lead to better behavior.
It seems logical, but the research suggests otherwise.
Yeah.
Harsh punishment can backfire and increase the risk of aggression and defiance.
So what's the alternative?
The book emphasizes positive parenting strategies, like setting clear limits, providing consistent consequences, and reinforcing positive behaviors.
It's about teaching the child what to do, not just what not to do.
Exactly. And it's also important to address any underlying emotional or mental health issues that might be contributing to the behavior.
Right.
A child struggling with anxiety or depression might act out as a way of coping.
It's like those externalizing behaviors are a symptom of a deeper internal struggle.
Exactly. The book also mentions cognitive factors,
Okay.
particularly hostile attribution bias.
Okay. What is hostile attribution bias?
It's the tendency to interpret ambiguous situations as threatening or hostile. So if a child bumps into another child in the hallway,
Right.
a child with hostile attribution bias might assume it was intentional and react aggressively.
So they're misreading social cues and assuming the worst.
Precisely. And this can lead to more aggressive or defiant behavior. The good news is that cognitive behavioral therapy can help children learn to recognize and challenge these negative thought patterns
Right.
and develop more realistic interpretations of social situations.
It's like we're giving them the tools to reframe their thinking and develop better social skills.
Exactly. Now let's shift gears to a topic that's incredibly important but often difficult to talk about: trauma and PTSD in children.
Okay.
What are some of the key takeaways from the book about how trauma impacts young people?
I'm ready to dive in. How does the book describe the way trauma can manifest differently in children?
The book emphasizes that children can experience trauma just like adults,
Right.
but they might express it in different ways depending on their age, developmental stage, and the nature of the trauma.
So even if they can't verbally express what they've experienced, it's still affecting them deeply.
Absolutely. Younger children might regress in their development.
Okay.
They might start wetting the bed again, have nightmares, or become clingy and fearful.
Mm.
Older children might withdraw, become irritable, or act out aggressively. They might even engage in risky behaviors as a way of coping.
So we need to be attuned to any significant changes in a child's typical behavior patterns, especially after a potentially traumatic event.
Exactly. And the book talks about PTSD,
Right.
post-traumatic stress disorder, and how it can show up in children. It explains the three main clusters of symptoms: re-experiencing the trauma,
Okay.
avoiding reminders of the trauma, and hyperarousal.
So they might be replaying the trauma in their minds through intrusive thoughts or nightmares,
Right.
avoiding anything that reminds them of the traumatic event and being constantly on edge and easily startled.
Precisely. And the book emphasizes that the diagnostic criteria for PTSD have been adapted for children,
Hmm.
recognizing that they might experience and express these symptoms differently than adults.
Can you give us an example of those adaptations?
Sure. One example is that young children might not be able to verbally describe their trauma.
Hmm.
They might reenact it through play or have nightmares without understanding what they're about.
So it's crucial to pay attention to their nonverbal communication.
Exactly. Another adaptation is that the criteria for experiencing fear, helplessness, or horror during the trauma
Hmm.
has been broadened for children to include disorganized or agitated behavior.
That makes sense. Young children might not have the emotional vocabulary to express those complex feelings.
Right, and it's important to remember that PTSD can have a long-lasting impact on a child's development,
Right.
affecting their emotional regulation, their relationships, their learning, and their overall well-being.
So recognizing and addressing PTSD in children is essential.
It is.
It's not something that they will just grow out of.
It's not, and the book reminds us that effective treatments like trauma-focused cognitive behavioral therapy
Right.
can help children process their trauma and develop healthy coping skills.
Okay, before we wrap up this part of our deep dive,
Right.
I want to touch on a topic that's woven throughout the entire book, children of diverse cultures.
It's a crucial element of child psychopathology.
Yeah.
We can't truly understand a child's mental health without considering their cultural background.
Right.
It's not just about the individual child, it's about understanding their family, their community, and their cultural heritage.
It's about recognizing that normal can look very different depending on the cultural context.
Exactly. And the book highlights the importance of cultural competence in assessment and treatment.
Hmm.
This means being aware of our own biases,
Right.
understanding the cultural values and beliefs of the families we work with, and adapting our approaches to be sensitive and relevant to their needs.
So it's about meeting the child and family where they are both literally and figuratively?
Precisely. The book even cites a report from the Surgeon General
Okay.
that revealed some disturbing disparities in mental health services for minority youth.
What kind of disparities are we talking about?
The report found that minority youth are less likely to have access to mental health services, less likely to receive those services, and when they do, the quality of care is often poorer than what their white counterparts receive.
That's unacceptable. We need to do better.
We do.
We need to create a more equitable system that serves all children.
Absolutely. And the book emphasizes the need for research that accurately reflects the diversity of our population.
So we need to move beyond a Eurocentric perspective and include diverse voices and experiences in our understanding of child psychopathology.
Exactly. The book advocates for a more inclusive approach that recognizes the complex interplay of culture development and mental health.
That's a powerful message, and I think it's a great place to pause for now.
Agreed. We've covered a lot of ground, but there's so much more to explore.
To our listeners, thank you for joining us on this deep dive into the fascinating world of child psychopathology. We'll be back soon to continue our exploration of this important topic.
Welcome back. Before we move on to other disorders, I think it's important to address a topic that's often shrouded in confusion: learning disabilities.
Yeah, learning disabilities. Most people have heard the term, but understanding what it actually means from a diagnostic perspective can be tricky. This textbook does a great job of highlighting the complexities involved.
Absolutely. Even defining and diagnosing learning disabilities has been a source of debate and controversy for decades. The book really emphasizes the need to rule out other possible explanations before concluding that a child's struggles are due to a learning disability.
So it's not as simple as observing that a child is having trouble in school and slapping a label on them.
Not at all. There could be a multitude of factors at play. For example, a child might have undiagnosed vision or hearing problems, be facing emotional difficulties that interfere with learning, or simply not be receiving adequate instruction.
It seems like those factors would be far easier to address than an actual learning disability.
You're absolutely right. It highlights the need for a comprehensive evaluation that considers the whole child and their environment. Now, the book mentions a specific model that's been used to diagnose learning disabilities for a while called the discrepancy model.
Okay, what's the discrepancy model all about?
It involves comparing a child's intellectual ability, measured by an IQ test, to their academic achievement. If their achievement falls significantly short of what their IQ would predict, it's considered evidence of a learning disability.
It's like saying this child has the potential to excel, but something is blocking their ability to reach that potential.
Exactly. But the book points out that this model has faced quite a bit of criticism over the years.
What are some of the issues with the discrepancy model?
Well, for one, it can be pretty subjective. Determining what constitutes a significant discrepancy is often a matter of opinion. There's no clear-cut answer.
So two professionals might look at the same data and come to different conclusions.
Precisely, another major criticism is that this model often leads to a wait-to-fail approach. We end up waiting until a child is already struggling significantly before even considering a learning disability.
That seems counterintuitive. Wouldn't early identification be more beneficial?
Absolutely. The book emphasizes that the earlier we can identify and address learning difficulties, the better the outcome for the child. It's about being proactive rather than reactive.
Are there any alternative approaches to the discrepancy model that address these concerns?
The book highlights a model called Response to Intervention, or RTI. It involves providing struggling students with different tiers of support, starting with general classroom interventions and progressing to more individualized support if needed.
So it's like a tiered system of support that allows us to try different strategies before jumping to a diagnosis.
Exactly. If a child responds well to these early interventions, it suggests that their difficulties might have stemmed from instructional gaps rather than a learning disability.
But if they continue to struggle despite these supports, it might indicate a learning disability, and further evaluation would be warranted.
Precisely. It's a more nuanced and individualized approach that focuses on meeting the child's specific needs.
Now, the book also delves into specific types of learning disabilities, right? I know we often hear about dyslexia, but it's only one piece of the puzzle.
That's right. The book discusses reading disorders, math disorders, and disorders of written expression. It's important to note that these are distinct challenges and can even co-occur.
So a child could have a reading disorder and a math disorder at the same time.
Absolutely. It's not about fitting neatly into one category. It's about understanding the child's unique profile of strengths and weaknesses.
Okay, let's talk about reading disorders. What makes a reading disorder, or dyslexia as it's commonly called, different from just having some trouble with reading?
Dyslexia involves a specific difficulty with decoding, breaking down words into their individual sounds. It's more than just struggling to read aloud. It affects reading fluency and comprehension.
So a child with dyslexia might be able to sound out a word, but do it very slowly and laboriously. And even if they manage to read a passage, they might not understand what they've just read.
Exactly. And this can obviously have a huge impact on their academic progress, not to mention their self-esteem and confidence as a learner.
And what about math disorders? I imagine those can be just as debilitating.
They can. Children with math disorders might struggle with understanding basic math concepts, doing calculations, or solving problems. It's not simply about memorizing times tables. It's about a deeper understanding of how numbers work and how to apply mathematical principles.
It seems like these challenges could make it difficult not only in math class, but also in everyday life.
You're absolutely right. Simple tasks like managing money or measuring ingredients while cooking could become incredibly challenging.
And what about disorders of written expression? I imagine those are often overlooked because the struggles might not be as apparent as those with reading or math.
That's true. Disorders of written expression can manifest as difficulties with writing, spelling, and grammar. It's not simply about messy handwriting or the occasional spelling error. It's about a persistent struggle to express thoughts and ideas in written form.
It seems like these challenges could be particularly frustrating because they affect a child's ability to communicate effectively.
Exactly, and they can have a significant impact on a child's academic performance across a wide range of subjects. Now, the book also provides some interesting historical context around learning disabilities. It highlights how the federal definition has evolved over time.
That's interesting. What are some of the key changes that have been made?
Well, the book mentions a landmark piece of legislation, the Individuals with Disabilities Education Act, or IDEA. This law guarantees a free and appropriate public education for all children with disabilities, including learning disabilities.
So it ensures that these children have access to the support and services they need to succeed in school.
Exactly. And the book highlights how the definition of learning disabilities within IDEA has been revised over time to be more inclusive and responsive to the diverse needs of these students.
So we're moving in the right direction, recognizing that learning disabilities are not a one-size-fits-all category, and that each child needs individualized support to thrive.
Precisely. And the book emphasizes that early identification and intervention are key with the right support. Children with learning disabilities can learn to overcome their challenges and achieve their full potential.
That's encouraging to hear. Now let's move on from the world of learning to another area that can be particularly sensitive: elimination disorders. I admit it's not the most glamorous topic, but it's important to address.
You're absolutely right. These disorders, while often overlooked, can be incredibly distressing for children and their families. The book focuses primarily on two: enuresis and encopresis.
Okay, let's break those down. What exactly is enuresis?
Enuresis, in simple terms, is repeated urination in clothing or in bed. And before you think, oh, that's just bedwetting, it's crucial to remember that for a diagnosis of enuresis, the child has to be at least 5 years old, and the behavior has to be happening at least twice a week for 3 consecutive months.
So it's not just an occasional accident, it's a persistent pattern that goes beyond what we'd expect for typical development.
Exactly. And the book delves into the different subtypes of enuresis: nocturnal, diurnal, and a combination of both.
So nocturnal enuresis is bedwetting, diurnal is wetting during the day, and some children experience both.
Precisely. And this distinction is important because it can point to different underlying causes and potential treatment approaches.
This makes sense. What are some of the factors that might contribute to enuresis?
The book explores a range of possibilities, from biological factors like delayed bladder maturation or genetics to psychological factors like stress or anxiety.
So it's another example of how the biological and psychological are intertwined when it comes to children's mental health.
Absolutely. And it's important to note that enuresis often runs in families, suggesting a possible genetic component.
That's interesting. So if a parent struggled with bedwetting as a child, their child might be more susceptible to it as well.
That's a possibility, although it's not a guarantee now. The book also discusses how the way we perceive and respond to enuresis can play a role in how distressing it is for the child.
You mean if we shame or punish a child for bedwetting, it can actually make the problem worse?
Exactly. It can create a cycle of anxiety and stress that further exacerbates the issue. Instead, the book emphasizes the importance of a supportive and understanding approach.
So it's about reassuring the child that they're not alone, that bedwetting is a common problem, and that there are effective treatments available.
Precisely, treatments can range from behavioral techniques like using a moisture alarm to medical interventions like medication.
Okay, let's move on to encopresis. I'm guessing this one involves bowel movements.
You're exactly right. Encopresis is the repeated passage of feces into inappropriate places like clothing or on the floor. And similar to enuresis, the child has to be at least 4 years old for a diagnosis, and the behavior has to be happening at least once a month for 3 consecutive months.
So again, it's not just an isolated incident, but a persistent pattern. What are some of the possible causes of encopresis?
Similar to enuresis, the book explores a range of factors. Sometimes it's related to constipation, where the child might hold back bowel movements for so long that they eventually have an accident. Other times, it might be linked to psychological factors like stress, anxiety, or even a history of trauma.
So once again, we see how crucial it is to look at the whole child and their experiences when trying to understand these challenges.
Exactly, and the treatment approach for encopresis often depends on the underlying cause, if constipation is the culprit. Medical interventions might be necessary if psychological factors are involved. Therapy can help the child address those issues and develop healthier coping mechanisms.
It's like we're detectives piecing together the clues to understand the underlying puzzle and find the best solution for each child.
That's a great analogy. Now, shifting gears again, let's talk about another set of disorders that can significantly impact a child's development. Communication and motor disorders. These might not always be as outwardly noticeable as some of the other challenges we've discussed, but they can have a profound impact on a child's ability to learn, interact, and thrive.
Absolutely. Communication and motor disorders can sometimes fly under the radar, but they can present significant obstacles for children. What are some of the key areas that these disorders affect?
Well, these disorders can affect a child's ability to produce and understand language coordinate movements and perform fine motor tasks.
So we're talking about things like speaking, writing, walking, and even things like buttoning a shirt or holding a pencil.
Exactly, and the book dives into several specific disorders that fall under this umbrella, including language disorder, speech sound disorder, childhood onset fluency disorder, also known as stuttering, social pragmatic communication disorder, developmental coordination disorder, and stereotypic movement disorder.
Wow, that's quite a list. Let's try to break down a few of these. What are the key features of language disorder?
Children with language disorder have difficulty acquiring and using language. They might struggle with understanding spoken language, expressing themselves verbally, or using correct grammar and syntax.
So it's more than just a delay in language development. It's a persistent difficulty with language acquisition and use that significantly impacts their ability to communicate effectively.
Precisely. And this can affect their social interactions, academic performance, and overall development. The book highlights the importance of early intervention for language disorder, as it can have a significant impact on a child's trajectory.
It makes sense that the earlier we can provide support, the better the chances of helping them catch up and develop those essential language skills.
Exactly. Now, what about speech sound disorder? How does that differ from language disorder?
Well, based on the name, I'm guessing it involves difficulties with producing speech sounds correctly. But how is it different from just having a lisp or some other common speech quirk?
You're on the right track. Children with speech sound disorder have difficulty producing speech sounds accurately or fluently. It goes beyond typical developmental errors or regional dialects.
So we're talking about errors that persist beyond what we would typically expect for their age and that interfere with their ability to be understood by others.
Exactly, and the book emphasizes that this disorder can affect a child's self-esteem and confidence, making them reluctant to speak or participate in social situations.
I can see how that would be the case. It's hard enough to navigate social interactions as a child, but when you're constantly worried about being misunderstood or made fun of for the way you speak, it can be incredibly isolating.
Right now, another disorder that falls under this category is childhood onset fluency disorder, or stuttering as it's more commonly known.
Stuttering. I think most of us have heard of stuttering, but I'm not sure everyone understands what actually causes it or how it's treated.
That's true. Stuttering involves disruptions in the flow of speech characterized by repetitions of sounds or syllables, prolongations of sounds or blocks where the speaker is unable to produce a sound. It can be incredibly frustrating for both the speaker and the listener.
It seems like it would be especially challenging for children who are already navigating the complexities of social interactions and developing their communication skills.
Absolutely. Stuttering can make a child feel self-conscious, anxious, and even avoid social situations altogether.
So what does the book say about the causes of stuttering? Is it something that's learned or is it more of a biological predisposition?
The book explores several theories, but the exact cause of stuttering remains somewhat of a mystery. It's likely a complex interplay of genetic predispositions, neurological factors, and environmental influences.
So it's probably a combination of nature and nurture, as with so many of the challenges we've discussed today.
Exactly, and the treatment approach often involves a combination of strategies, including speech therapy, counseling, and support groups.
It seems like a multifaceted approach would be the most effective, addressing both the physical aspects of stuttering and the emotional and social impact it can have on a child.
That's right. Now, let's move on to another disorder mentioned in the book, social pragmatic communication disorder. This one might be less familiar to our listeners.
Yes, social pragmatic communication disorder. It sounds like it involves difficulties with the social aspects of communication. Can you elaborate on that?
Absolutely. This disorder involves persistent challenges with the social use of verbal and nonverbal communication. It's not about a lack of language skills. It's about difficulties using language effectively in social contexts.
So they might have a good vocabulary and be able to speak grammatically, but they struggle with things like understanding social cues, taking turns in conversations, or adapting their communication style to different situations.
Exactly. They might misinterpret sarcasm, have trouble understanding humor, or make inappropriate comments that unintentionally offend others.
I can see how that would lead to misunderstandings and make it difficult for them to form and maintain relationships.
You're absolutely right, and the book emphasizes that this disorder can have a significant impact on a child's social development and well-being.
Now, what about the other two disorders mentioned in this section, developmental coordination disorder and stereotypic movement disorder? How do those affect a child's development?
Developmental coordination disorder, or DCD, involves a marked impairment in motor coordination
Yeah.
that significantly interferes with daily activities and academic achievement. These children struggle with tasks that require motor skills, such as handwriting, dressing, or playing sports.
So they might be clumsy, have poor balance, or struggle with fine motor control. It seems like these challenges would affect their confidence and self-esteem, especially in settings where they're expected to perform physical tasks.
Absolutely. And often children with DCD are mislabeled as lazy or unmotivated when in reality they're struggling with underlying motor coordination difficulties.
That's heartbreaking to hear. It highlights the importance of understanding the nuances of these disorders and not jumping to conclusions based on outward behavior.
So right now, the last disorder in this section, stereotypic movement disorder, involves repetitive, seemingly purposeless movements, such as hand flapping, rocking, or head banging.
Those behaviors can be quite noticeable, and I imagine they might cause concern for parents and teachers who might not understand what's going on.
Absolutely. It's important to understand that these movements are not under the child's conscious control and are often a way of regulating sensory input or coping with stress or anxiety.
So rather than trying to suppress these behaviors, it's more about understanding the underlying need they're fulfilling and finding alternative ways to help the child meet that need.
Exactly. The book emphasizes the importance of a comprehensive approach that addresses both the movements themselves and any underlying emotional or sensory issues that might be contributing to them.
This has been an incredibly insightful deep dive into the world of communication and motor disorders. It's a reminder that even those challenges that might not be as readily apparent can have a profound impact on a child's life.
You're absolutely right. And it underscores the importance of careful observation, accurate diagnosis, and individualized interventions that address the specific needs of each child.
Okay, let's take a moment to shift our focus to another significant category of disorders that we often see in children, neurodevelopmental disorders. The book provides a comprehensive overview of this category, covering a range of conditions that affect brain development and function.
Yes, neurodevelopmental disorders encompass a broad spectrum of challenges, from intellectual disability and autism spectrum disorder to attention deficit hyperactivity disorder, which we've already touched upon.
Right, it seems like ADHD often overlaps with other diagnoses, particularly within this category. It's another reminder that we can't view these disorders in isolation.
Absolutely. Now, let's start with intellectual disability, which is often misunderstood and stigmatized. What are some of the key takeaways from the book about how we define and understand intellectual disability?
Well, I know that in the past, terms like mental retardation were used to describe intellectual disabilities, but thankfully, we've moved away from that outdated and offensive language.
You're absolutely right. The terminology has evolved significantly, reflecting a greater understanding of the complexities of intellectual disability and the importance of using respectful language.
So how does the book define intellectual disability?
It defines intellectual disability as a condition characterized by significant limitations in both intellectual functioning and adaptive behavior originating before the age of 18.
So it's not just about IQ scores, it's also about how well a person can function in everyday life, manage their personal care, communicate effectively, and navigate social situations.
Exactly. It's a holistic view that recognizes that intellectual disability is not just about cognitive limitations, but also about the ability to adapt and function in the real world.
And the book emphasizes that intellectual disability is a spectrum, right? There's a wide range of severity, and each individual has their own unique strengths and challenges.
Absolutely. The book highlights the importance of individualized assessments and supports that cater to each person's specific needs and goals.
Now let's move on to autism spectrum disorder, or ASD as it's commonly known. I think most people have heard of autism, but understanding the complexities of the spectrum can be challenging. How does the book break down the key features of ASD?
The book explains that ASD is characterized by persistent deficits in social communication and social interaction across multiple contexts, as well as restricted repetitive patterns of behavior, interests, or activities.
So we're talking about difficulties with social skills, communication, and flexibility in thinking and behavior.
Exactly. Individuals with ASD might struggle with understanding social cues, engaging in reciprocal conversations, or adapting to changes in routine. They might also exhibit repetitive behaviors like hand flapping, or have intense narrow interest.
And the book emphasizes that ASD is a spectrum, meaning that individuals with autism can present with a wide range of strengths and challenges.
Absolutely. Some individuals with ASD might be nonverbal, while others might have highly developed language skills. Some might be highly sensitive to sensory input, while others might crave sensory stimulation.
It seems like there's no one-size-fits-all description of autism. Each individual is unique.
Exactly. And that's why individualized assessments and supports are so crucial. The book highlights the importance of understanding the individual's specific needs and strengths to create an intervention plan that helps them thrive.
Now, we've already talked a bit about ADHD, but the book delves into more detail about this disorder as well. What are some of the key things it highlights about the different subtypes of ADHD?
The book reminds us that ADHD is characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development.
And it highlights those three presentations: predominantly inattentive, predominantly hyperactive impulsive, and combined, right?
It's exactly. The book delves into each presentation, describing the specific challenges and behaviors associated with them. For instance, the inattentive type, as we discussed earlier, often involve difficulty sustaining attention, being easily distracted, and struggling with organization.
And the hyperactive impulsive type might involve fidgeting restlessness, difficulty waiting their turn and interrupting others.
Precisely. And the combined type, as you might guess, involves a blend of both inattentive and hyperactive impulsive symptoms.
The book also discusses the impact of ADHD on a child's life, right? It's not just about classroom behavior. It can affect their relationships, self-esteem, and overall well-being.
Absolutely. And the book explores different treatment approaches, including medication behavioral therapies and educational interventions.
It's about finding the right combination of supports to help children with ADHD manage their symptoms and reach their full potential.
Precisely. Now let's move on to another significant category of disorders covered in the book: disruptive impulse control and conduct disorders. These disorders often involve behaviors that are challenging for both children and those around them.
Yes, these disorders can be particularly difficult to manage because they often manifest as outward behaviors that disrupt families, classrooms, and communities. We've already talked about oppositional defiant disorder and conduct disorder. But what are some of the other disorders that fall under this umbrella?
The book delves into intermittent explosive disorder, pyromania, and kleptomania. These disorders all involve difficulties with impulse control, but they manifest in distinct ways.
Okay, let's start with intermittent explosive disorder. What exactly does that entail?
Intermittent explosive disorder involves recurrent behavioral outbursts, representing a failure to control aggressive impulses. These outbursts can be verbal or physical, and are significantly out of proportion to the situation of provocation.
So we're talking about explosive anger that seems to come out of nowhere and is far more intense than the situation warrants.
Exactly. These outbursts can be frightening and destructive, and they can have significant consequences for the individual and those around them.
What about pyromania? That one sounds particularly worrisome.
Pyromania is characterized by deliberate and purposeful fire setting on more than one occasion. It's not just about being fascinated by fire, it's about an intense urge to set fires and a sense of relief or gratification afterward.
So it's a compulsive behavior that can obviously be incredibly dangerous and destructive.
Absolutely. And it's important to distinguish pyromania from fire setting that's done for other reasons, such as cover up a crime, express anger, or gain attention.
And lastly, what about kleptomania? I imagine that one involves stealing.
You're right. Kleptomania involves recurrent failure to resist impulses to steal objects that are not needed for personal use or for their monetary value.
So it's not about stealing for profit or because they can't afford to buy the item. It's about an uncontrollable urge to steal.
Exactly. And the book highlights that individuals with kleptomania often feel guilty or ashamed about their stealing, but they're unable to resist the impulse.
It seems like all of these disorders involve a disconnect between the impulse and the ability to control it.
That's a great observation, and the book explores the possible underlying causes of these disorders, including biological factors, psychological factors, and social influences.
So once again, we see that complex interplay of nature and nurture.
Exactly. And the treatment approaches for these disorders often involve a combination of therapy, medication, and lifestyle changes.
It seems like a multifaceted approach is often necessary when addressing these challenging behaviors.
Absolutely. And it's important to remember that recovery is possible with the right support and interventions.
Okay, let's shift gears now and talk about a topic that can be particularly sensitive, but is crucial to address: trauma and stressor-related disorders. We've already touched upon post-traumatic stress disorder, but the book delves deeper into this category, exploring a range of disorders that can arise in response to traumatic or stressful experiences.
Yes, this is a crucial area to understand, especially when working with children. The book highlights how children are particularly vulnerable to the impact of trauma and stress, and these experiences can have long-lasting consequences for their development and well-being.
So what are some of the other disorders besides PTSD that the book discusses in this category?
It covers reactive attachment disorder, disinhibited social engagement disorder, acute stress disorder, and adjustment disorders.
Okay, let's break down a few of these. What are the key features of reactive attachment disorder?
Reactive attachment disorder occurs in children who have experienced extreme neglect or deprivation in early childhood. It's characterized by a consistent pattern of inhibited, emotionally withdrawn behavior toward adult caregivers.
So instead of seeking comfort and security from their caregivers, these children might avoid physical contact, resist affection, or have difficulty regulating their emotions.
Exactly, and this can stem from a lack of consistent nurturing care in their early years. It's heartbreaking to think about what these children have endured.
It is, and it highlights the profound impact that early childhood experiences can have on a child's emotional and social development. Now, what about disinhibited social engagement disorder? How does that differ from reactive attachment disorder?
Disinhibited social engagement disorder is also thought to stem from early neglect or deprivation, but it manifests in a very different way. Instead of being withdrawn and avoidant, these children exhibit overly familiar behavior with strangers.
So they might approach unfamiliar adults without hesitation, engage in overly friendly interactions, or even wander off with strangers.
Exactly, and this can be extremely dangerous, putting the child at risk of harm. It's important to note that this behavior is not simply a sign of being friendly or outgoing. It stems from a lack of appropriate attachment and boundaries, making it difficult for them to distinguish between safe and unsafe individuals.
It seems like both reactive attachment disorder and disinhibited social engagement disorder underscore the importance of early intervention.
They do. The book emphasizes that early intervention is critical to help these children develop secure attachments and build trust with caregivers. Therapy can play a crucial role in helping them learn to regulate their emotions and develop appropriate social boundaries.
Okay, let's move on to acute stress disorder. How does that differ from PTSD?
Acute stress disorder can develop after exposure to a traumatic event, just like PTSD. However, it typically occurs within the first month after the trauma, and the symptoms are generally shorter-lived.
So it's like an initial intense reaction to the trauma that might resolve within a few weeks?
Exactly. The symptoms of acute stress disorder can be similar to those of PTSD, including intrusive thoughts, nightmares, flashbacks, avoidance, and hyperarousal. But if the symptoms persist for more than a month, a diagnosis of PTSD might be warranted.
So it's about the duration and severity of the symptoms. What about adjustment disorders? How do those fit into this category?
Adjustment disorders involve the development of emotional or behavioral symptoms in response to an identifiable stressor, such as a significant life change, a loss, or a major disappointment.
So we're talking about things like moving to a new school, experiencing the death of a loved one, or going through a divorce.
Exactly, and the symptoms can vary widely, including anxiety, depression, withdrawal, anger, or even physical complaints.
It seems like adjustment disorders highlight the fact that even seemingly normal life events can be incredibly stressful for children and can trigger significant emotional and behavioral challenges.
You're absolutely right. It emphasizes the importance of being attuned to a child's reactions to life changes and providing support and coping mechanisms to help them navigate these transitions successfully.
Okay, let's move on to another category of disorders that can significantly impact a child's life. Feeding and eating disorders. We often associate these disorders with adolescents and adults, but the book reminds us that they can also occur in younger children.
You're absolutely right, and it's crucial to recognize the early warning signs of these disorders and intervene as early as possible. The book focuses on several specific disorders within this category, including pica rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder.
Okay, that's quite a list. Let's start with pica. What exactly is that?
Pica involves the persistent eating of non-nutritive, non-food substances over a period of at least 1 month. We're talking about things like dirt, paint, chips, hair, or even feces.
Wow, that sounds incredibly dangerous. What causes a child to engage in this behavior?
The book explores several possible causes, including nutritional deficiencies, developmental delays, and mental health conditions. Sometimes pica can be a way for a child to self-stimulate or soothe themselves, particularly if they have sensory processing difficulties.
So it's often more than just a bad habit. It's a sign of an underlying need that's not being met. What about rumination disorder? What does that entail?
Rumination disorder involves the repeated regurgitation of food over a period of at least 1 month. The regurgitated food might be rechewed, reswallowed, or spit out.
That sounds incredibly distressing for both the child and those around them. What causes this behavior?
The book suggests that rumination disorder can be a way for a child to self-soothe or gain attention. It can also be associated with gastrointestinal problems or developmental delays.
So, like pica, it seems to be a behavior that serves a purpose, even if that purpose is harmful or unhealthy. What about avoidant restrictive food intake disorder? How does that differ from picky eating, which seems to be pretty common in young children?
That's a great question. Picky eating is certainly a normal developmental phase for many children, but avoidant restrictive food intake disorder, or ARFID, goes beyond typical picky eating. It involves a persistent avoidance or restriction of food intake that leads to significant weight loss, nutritional deficiencies, or interference with psychosocial functioning.
So these children are not just refusing to eat their vegetables, they're limiting their food intake to the point where it's affecting their health and development.
Exactly. They might have an extreme aversion to certain textures, colors, or smells of food.
Yeah.
They might fear choking or vomiting, or they might simply lack interest in eating.
And this can obviously have serious consequences for their physical growth and overall well-being.
Absolutely. And the book highlights the importance of early intervention to address any underlying medical or psychological issues and to help these children develop a healthier relationship with food.
Okay, let's move on to the eating disorders that are more commonly associated with adolescents and adults: anorexia nervosa, bulimia nervosa, and binge eating disorder.
These disorders, while often sharing some common features, involve distinct patterns of behavior and can have serious consequences for an individual's physical and mental health.
Let's start with anorexia nervosa. What are the key features of this disorder?
Anorexia nervosa is characterized by a persistent restriction of energy intake that leads to significantly low body weight. Individuals with this disorder have an intense fear of gaining weight even if they're already underweight, and a distorted perception of their body shape and size.
So it's not just about wanting to be thin, it's about a deep-seated fear of fatness that drives dangerous behaviors.
Exactly, and this fear can manifest in different ways. Some individuals severely restrict their food intake, while others engage in binge eating, followed by purging behaviors like self-induced vomiting or misuse of laxatives or diuretics.
So there are different subtypes of anorexia, each with its own set of challenges. What about bulimia nervosa? How does that differ from anorexia?
Individuals with bulimia nervosa also engage in recurrent episodes of binge eating, consuming large amounts of food in a short period of time and feeling a lack of control during these episodes.
But what distinguishes bulimia from anorexia?
A key distinction is that individuals with bulimia engage in recurrent inappropriate compensatory behaviors to prevent weight gain, such as self-induced vomiting, misuse of laxatives or diuretics, excessive exercise, or fasting. And like those with anorexia, they have a distorted body image and are overly concerned with their weight and shape.
It sounds like both anorexia and bulimia can have devastating consequences for a person's physical and mental health.
Absolutely. The book really stresses that these are serious illnesses, not just fads or phases. Starvation can lead to organ damage, electrolyte imbalances, and even death. And the purging behaviors common in bulimia can damage the teeth, esophagus, and digestive system.
It's a reminder that we need to take these disorders seriously and seek professional help if we or someone we know is struggling. What about binge eating disorder? How does that fit into this category?
Binge eating disorder involves recurrent episodes of binge eating, similar to bulimia, but without the regular compensatory behaviors like purging or excessive exercise.
So individuals with binge eating disorder might feel a lack of control during these episodes, but don't engage in those harmful behaviors to counteract the binging.
Exactly. And these episodes are often associated with marked distress and feelings of guilt or shame. The book emphasizes that binge eating disorder can lead to significant weight gain and other health problems like diabetes or heart disease.
It's another reminder that these are not just vanity issues or choices. They're complex disorders with serious implications for a person's overall health and well-being.
I couldn't agree more. Now, shifting gears a bit, let's talk about another category of disorders that can be incredibly challenging, particularly for those around the individual struggling sleep-wake disorders. I think we can all relate to the occasional sleepless night or difficulty waking up in the morning, but these disorders go beyond those common experiences.
Absolutely. We've all had those nights where we toss and turn, but for people with sleep-wake disorders, these struggles are persistent and significantly impact their daily lives. What are some of the specific disorders that the book highlights in this category?
The book covers a range of sleep-wake disorders, including insomnia disorder, hypersomnolence disorder, narcolepsy, obstructive sleep apnea, hypopnea nightmare disorder, and non-rapid eye movement sleep arousal disorders.
Okay, that's quite a variety. Let's try to unpack a few of these. What are the key features of insomnia disorder? I think most people have experienced insomnia at some point. So what makes it a disorder?
Yeah. Insomnia disorder goes beyond those occasional sleepless nights. It involves persistent difficulty initiating or maintaining sleep, or waking up too early and being unable to fall back asleep despite adequate opportunity for sleep.
So it's about the frequency, duration, and impact on daily functioning. If you're constantly exhausted and your ability to focus or function at work or school is suffering because of sleep problems, that's when it becomes a disorder.
Exactly. And the book emphasizes that insomnia disorder can be incredibly frustrating and debilitating, leading to fatigue, irritability, difficulty concentrating, and even an increased risk of accidents.
It's amazing how much sleep affects our overall well-being. What about hypersomnolence disorder? Is that like the opposite of insomnia?
You could say that hypersomnolence disorder involves excessive sleepiness, despite getting at least 7 hours of sleep. These individuals might have difficulty staying awake during the day, experience prolonged nighttime sleep, or have excessive daytime sleepiness that interferes with daily activities.
So even after a full night's sleep, they still struggle to stay awake and alert.
Exactly, and this can obviously has a significant impact on their work, school, and social lives.
Now, what about narcolepsy? I've heard that term before, but I'm not sure I fully understand what it entails.
Narcolepsy is a neurological disorder that affects the brain's ability to regulate sleep-wake cycles. It's characterized by excessive daytime sleepiness, often accompanied by sudden, uncontrollable episodes of falling asleep known as sleep attacks.
So these sleep attacks can occur at any time, even during activities like driving or working. That sounds incredibly dangerous.
It can be. And in addition to excessive sleepiness and sleep attacks, people with narcolepsy might experience other symptoms like cataplexy, sleep paralysis, and hypnagogic hallucinations.
I show those.
Cataplexy involves a sudden loss of muscle tone, often triggered by strong emotions like laughter or excitement. It can range from a slight weakness in the knees to a complete collapse. Sleep paralysis is a temporary inability to move or speak while falling asleep or waking up, and hypnagogic hallucinations are vivid dreamlike experiences that occur while falling asleep.
Wow, narcolepsy sounds incredibly challenging to live with. It's like your sleep-wake cycle is completely out of whack, and you're never quite sure when you're going to fall asleep or experience those other unsettling symptoms.
Exactly. And it's important to note that narcolepsy is a chronic condition, but with proper diagnosis and management, individuals can learn to cope with their symptoms and live fulfilling lives.
Now, what about obstructive sleep apnea hypopnea? That one sounds more like a breathing problem than a sleep disorder.
You're right, it does involve breathing, but it's categorized as a sleep disorder because it disrupts sleep patterns and leads to daytime sleepiness. Obstructive sleep apnea, hypopnea, is characterized by repeated episodes of complete or partial blockage of the upper airway during sleep.
So they essentially stop breathing for brief periods throughout the night.
Exactly. These pauses in breathing can last from a few seconds to a minute or more, and can occur hundreds of times throughout the night each time this happens. The brain briefly awakens the person to restart breathing, disrupting their sleep cycle and preventing them from reaching those deep restorative stages of sleep.
That sounds exhausting. No wonder they experience excessive daytime sleepiness.
It is, and it's important to note that obstructive sleep apnea hypopnea is a serious medical condition that can increase the risk of other health problems, like high blood pressure, heart disease, and stroke.
So it's not just about feeling tired, it's about addressing a potentially life-threatening condition.
Exactly. Now let's move on to nightmare disorder. I think most people have had nightmares at some point, so what makes it a disorder?
That's a great question. I'm guessing it has to do with the frequency and intensity of the nightmares and the impact they have on a person's sleep and well-being.
You're absolutely right. Nightmare disorder involves recurrent episodes of well-remembered, extremely disturbing dreams that usually involve threats to survival security or physical integrity. These nightmares typically occur during the second half of the night during REM sleep and often cause the person to awaken feeling frightened or anxious.
So they're not just bad dreams that you forget about quickly. They're vivid, intense, and can leave you feeling shaken even after you wake up.
Exactly. And for people with nightmare disorder, these nightmares occur frequently cause significant distress and can even interfere with their sleep and daytime functioning.
Now, what about non-rapid eye movement sleep arousal disorders? What are those all about?
These disorders involve incomplete awakenings from sleep, usually during the first third of the night, during non-REM sleep. They often involve sleepwalking or sleep terrors.
So the person might get out of bed and walk around, or they might cry out, appear terrified, and be difficult to console even though they're still asleep.
Exactly, and they might have no memory of these episodes upon waking.
That sounds incredibly unsettling both for the person experiencing these episodes and for anyone who witnesses them.
It can be. The book delves into the possible causes of these disorders, exploring factors like genetics, sleep deprivation, stress, and even certain medications.
It seems like there are so many different factors that can affect our sleep and contribute to these disorders.
You're absolutely right, and the book highlights the importance of a thorough assessment to rule out any underlying medical conditions and to determine the most effective treatment approach.
Okay, let's move on to another category of disorders that we often see in children. Gender dysphoria. This can be a sensitive and controversial topic, so I'm curious to hear how the book addresses it.
The book approaches gender dysphoria with sensitivity and a focus on the individual's experience. It explains that gender dysphoria involves a marked incongruence between one's experience, expressed gender, and assigned gender.
So it's about a disconnect between the gender someone identifies with and the gender they were assigned at birth.
Exactly. And this incongruence can lead to significant distress and impairment in social, occupational, or other important areas of functioning.
The book emphasizes that gender dysphoria is not a mental illness, right? It's about a person's gender identity, which is a fundamental aspect of who they are.
Exactly. And the book highlights the importance of providing support and affirmation for individuals experiencing gender dysphoria regardless of their age. This might involve exploring their gender identity, providing access to counseling and support groups, and helping them navigate social and medical transitions if desired.
It's about creating a safe and affirming environment where individuals can explore their gender identity and make choices that align with their authentic selves.
Precisely.
Yeah.
And it's crucial to remember that the experiences of individuals with gender dysphoria can vary widely, and there's no one-size-fits-all approach to support and treatment.
This has been an incredibly insightful journey through the world of child psychopathology. We've covered so much ground today, from those early milestones in the field to the complexities of specific disorders and the ever-important considerations of culture, diversity, and development.
It's been a whirlwind tour. But I think the most valuable takeaway is that child psychopathology is not just about labels and diagnoses. It's about understanding the struggles of real children and finding ways to help them navigate those challenges and thrive.
I completely agree, and it's a reminder that we all have a role to play in supporting the mental health and well-being of young people, whether we're parents, teachers, therapists, or simply concerned citizens. We can all make a difference by being informed, compassionate, and proactive.
Well said. By understanding child psychopathology, we can create a more supportive and nurturing world for all children.
To our listeners, thank you for joining us on this deep dive. We hope you found it as enlightening as we did. Remember, knowledge is power, and by deepening our understanding of child psychopathology, we can create a brighter future for the next generation.